What is arterial thrombosis? Arterial thrombosis occurs when a blood clot, thrombus, forms in an artery, obstructing blood flow to vital organs or tissues. Arteries are responsible for carrying oxygen-rich blood from the heart to the rest of the body, so a blockage can lead to serious complications, including tissue damage or organ failure. This condition is a medical emergency requiring prompt treatment. Causes of arterial thrombosis. 1. Atherosclerosis. The most common cause of arterial thrombosis occurs when fatty deposits, plaques, build up on the inner walls of arteries, narrowing them and increasing the risk of clot formation. 2. Vascular injury. Damage to the artery wall from trauma, surgery, or inflammation can trigger clot formation. 3. Hypercoagulability. Conditions that increase blood clotting tendencies, such as genetic clotting disorders, cancer, or pregnancy. 4. Other risk factors. Smoking, high blood pressure, hypertension, high cholesterol levels, diabetes, obesity, sedentary lifestyle. Symptoms of arterial thrombosis. The symptoms depend on the location of the clot and the organ or tissue affected. 1. Heart, myocardial infarction or heart attack, chest pain or pressure, angina, often radiating to the arm, neck, or jaw. Shortness of breath, nausea or vomiting, dizziness or fainting. 2. Brain, ischemic stroke, sudden weakness or numbness, typically on one side of the body. Difficulty speaking or understanding speech. Loss of vision in one or both eyes. Severe headache. 3. Peripheral arteries, limb ischemia. Sudden, severe pain in the affected limb. Coldness and paleness of the limb. Loss of sensation or paralysis in the limb. 4. Intestines, mesenteric ischemia. Severe abdominal pain. Nausea and vomiting. Bloody stools. Diagnosis. 1. Physical examination. Checking for signs of reduced blood flow, such as cold or pale extremities, weak pulses, or abnormal neurological findings. 2. Imaging tests. Doppler ultrasound, to assess blood flow in the affected artery. CT or MRI angiography. Detailed imaging of blood vessels to locate the clot. Electrocardiogram, ECG, or echocardiogram, to evaluate heart function if a cardiac source of the clot is suspected. 3. Blood tests. D-dimer test. Elevated levels may indicate clotting. Tests for clotting disorders or risk factors like cholesterol, glucose, or inflammatory markers. Treatment of arterial thrombosis. The treatment depends on the severity and location of the clot, and it may include both immediate interventions and long-term management. 1. Medications. Antiplatelets, e.g., aspirin, clopidogrel, prevent further platelet aggregation and clot growth. Thrombolytics, e.g., alteplase, break down the clot, used in emergencies like stroke or myocardial infarction. Anticoagulants, e.g., heparin, warfarin, reduce blood clotting and prevent new clots from forming. 2. Surgical interventions. Thrombectomy, surgical removal of the clot. Angioplasty and stenting, a catheter-based procedure to reopen the blocked artery and place a stent to keep it open. Bypass surgery, creating a new pathway for blood flow around the blocked artery. 3. Lifestyle modifications. Quitting smoking, managing blood pressure, cholesterol, and diabetes. Following a heart-healthy diet, low in saturated fats and high in fruits, vegetables, and whole grains. Regular physical activity. Complications. If untreated, arterial thrombosis can lead to severe complications, including 1. Heart attack or stroke. Permanent damage to the heart or brain tissue. 2. Limb ischemia. Gangrene, tissue death, requiring amputation. 3. Organ failure. Loss of function in affected organs, such as the kidneys or intestines. Prevention. Control risk factors. Manage conditions like hypertension, diabetes, and high cholesterol. Healthy lifestyle, regular exercise, balanced diet, and avoiding tobacco use. Medical management. Take prescribed medications, such as blood thinners or cholesterol-lowering drugs, as directed. Regular checkups. Routine health screenings to monitor and address risk factors. Arterial thrombosis is a life-threatening condition that requires early detection and treatment to prevent irreversible damage. Awareness of symptoms and risk factors can help individuals take proactive steps to reduce their risk.